Good afternoon and welcome to our Ask Me Anything session for oral surgeons. I am Veronica Figueroa, Director of Specialty Support at Aspen Dental Management, and we're excited to spend the next hour or so answering as many of your questions as possible. Before we get started, let us review how the questions will be taken. At the bottom of your screen, you will find the Q&A function. Please type your questions and we'll make sure to cover as many as we can during our time together. Let's have fun with this and get as much information from our panelists as you want. Our goal today is to help you understand more about our specialty model and how you can play an integral part of our Aspen family. Before we begin taking your questions, I want to give the opportunity to each of our panelists to introduce themselves. So where do they live? Where do they attend dental school and residency? And how long have they been with Aspen? Let's start with Dr. Kim, J. Kim, who, by the way, was our #1 oral surgeon in 2020. And then we'll go on to Dr. Robert Pierre to also introduce himself. So Dr. Kim.
Thank you, Veronica. Hey, hello, everyone. Hopefully you can see me. I don't get to see you guys, which is, a little disappointing, but let's see. I live in Maryland, state of Maryland, about 25 minutes above Washington, D.C. And then I went to NYU, College of Dentistry. That's dental school I went. And with the Maryland tie, I did do my residency here in state of Maryland, Bethesda. I joined the Army, and then I got my residency at the Walter Reed National Military Medical Center. It was a great experience. So I was actually active duty. And then after the completion of residency, Army sent me to Kentucky to serve my obligations. And I was working there for a couple of years, and that's when I met Aspen. I was looking for some part-time kind of moonlighting gig out there. And then I started Aspen in 2015 as a part-timer. And then, I really liked it. I enjoyed it. And then once I was done with my duty with the Army, and I was debating, hey, I asked Aspen, my family wants to go back to Maryland. And fortunately, it worked out. So I was able to relocate to Maryland. And then I stayed with the company, and here I am 3 years after. I'm still with Aspen in Maryland, working full-time as an oral surgeon with Aspen. So that's my little brief story.
Thank you, Dr. Kim. Dr. Pierre?
All right, good afternoon, everyone. Again, my name is Robert Pierre. I'm currently living and practicing in the Orlando, Florida area. Which I also grew up here growing up. I did my undergraduate studies at Emory University in Atlanta, then went on to dental school at University of Florida, and then from there matched at the Brooklyn Hospital Center in New York where I did my oral surgery training. And from there, like many of you, my initial encounter with Aspen was through a Vibe session that I went to in Boston. Fortunately for me, it was pre-COVID, so it was in person, and it was a great time. So hopefully, for future candidates going forward, we'll see if we get back to those type of situations. But that's where I got introduced to the culture of Aspen, and that really drew me in. So I'm the fresh surgeon on the block. So I once I finished residency, I signed on with Aspen and moved down to Florida, which was home for me. So that was important, coming back home for me. So here I am.
Thank you. Looks like the first question we have, and actually I'll ask either of our oral surgeons to answer. What are the pros and cons of working at Aspen?
I'll go first. I mean, again, fresh out. So I'm going on 6 or 7 months time working with Aspen now. And I can tell you from my limited time here, I think there's definitely a lot of pros. I think the pros for me coming in is you have a lot of autonomy, especially as the specialist and a surgeon, way more than you think you would have. With the DSO, you have complete autonomy over your schedules, how you want to practice. You can set your hours, the type of cases you want to see and done. You can kind of dictate how your schedule goes. And I would say the Aspen, the whole community, from corporate to the clinics, and the staff are very supportive. You know, they all want you to succeed. So they're all in your corner. They have your back. You know, you don't feel any pressure as far as what to do and what needs to be done. You know what you have to do. We're there to serve our patients to our best of our ability, and they make sure everything is there. Again, I don't have any, although I know surgeons in private practice, I don't have any private practice experience myself, but I can tell you you don't have the headache that a lot of surgeons I spoke to that own their own practice have in terms of running the show, payroll, taking care of like the business aspect of things, the paperwork and stuff like that. So you don't necessarily have to deal with that. And again, you have your set scheduled, you show up, you do your job, you see your patients with your team, and then, you go on about your day, you do what you have to do. So I think the flexibility, the support, equipment wise, state-of-the-art equipment that is at your disposal. Aspen has, they got great rates with all of that. So there's never a need or want in terms of supplies or equipment. They're able to supply everything you need to get to do the best practice job for your patients. The only con I would say from my experience so far, so compared to a private practice, you're not in one location, obviously. So there'll be multiple locations. Most of them are pretty reasonable driving distance for you anyway. So it's not too big an issue, but if, that could be a con if you're not interested in covering multiple locations. And then depending on the offices, you got to work with the general dentist. They'll be, treatment planning for you. So that's it's actually, con, but you can see it as a positive as well. You get the chance to work with those general dentists. And you can kind of pick their brain, discuss cases, see what they know, see what they don't know when it comes to implants. And that's just a way you can even teach, so that's also a plus. And then you can work together. And the cases that you're doing, jointly, the dentist is always there in the office. So if there's any question or anything like that, or, you see something interrupt, you can discuss, hey, I see this, what do you think of that? So you have that at your disposal versus if you got referred from an outside dentist, now you got to pick up the phone, get through the secretary, try to get the dentist on the line, stuff like that. So it's very convenient having the dentist in the office with you when you're seeing these patients.
Yeah, if I may just piggyback with Dr. Pierre, I absolutely agree with most of what he says. And the one big plus for me is that, I'm going into 7th year with Aspen, and it's, when you have it's just it's just a number game. You'll run into a liability issue, at some point in your career. And when being in Aspen, you have an excellent legal team, and you also have a great risk management team, always willing to support you. So I've had a couple experiences with them, and then it was, I felt like I had a tremendous support from them. So that was a big plus. Having many offices, I carry 16 offices. So I have 16 different locations. So, that could be a challenge, and that could be actually plus or minus. For me, it's a big plus because I feel like I run 16 different offices. So, that gives me a great compensation financially, and also it gives me a sort of a steady patient volume as well, and that's huge. And another thing he covered was a flexible schedule, and that is and it's a great plus, and no stress over staffing, and you don't have to deal with all the office stuff. And when you have a problem, you just kind of, hands off to a field support team, and they'll take care of it. So those are the big pluses for me.
I like something you mentioned, Doc, because another question just came in as you were talking, Dr. Kim. And so the question is, do you work with the same assistants every day, or does it change with each practice? You have 16 practices, so why don't you take that question?
So I'm actually very lucky. I have a great assistant who loves traveling with me as well. So I have my main DA, we call him lead DA. She goes where I go. And then I have 2 other assistants that kind of regionally covers sort of a west and east. So, assistant-wise, I'm always with the same assistants, and that's actually that you must have the same assistants, otherwise it's a challenge.
Dr. Pierre, this is assistant.
Yeah, same. I have 2 assistants, so I have 1 lead DA, and then my second assistant, and they go everywhere I go. So I cover now, I believe, 10 or 11 offices, and they're with me at each office. And it's great. It creates continuity. Going from place to place, we have our same. Once we develop a system, it's the same routine from office to office, so that doesn't change. And I will say, it's going in, it's really important. I mean, as good and as skilled as a surgeon as you can be, it's so important to have a really good supporting cast of your dental assistants. That really can, make or break the day.
Right. Just typically, basically, my lead assistants would carry all my sort of, hand pieces, monitors, and they'll set up everything ahead of time. So I typically start at 8 a.m. I see my first patient at 8 o'clock, and they're going around like 7:15, and they set up everything before I get there. So
Right.
that's what they'll do.
So talking about what your typical day looks like, Doc, I think this is a great segue into the next question is, Dr. Kim, how many days a month do you work and how many patients do you see every day on average?
I'm a little workaholic, so I work a lot, but typically I try to work 4 days to 5 days a week. Occasionally I do work on Saturdays. Company has one Saturday open per month. And then, I don't want to, I got 2 girls and I got family, so I try not to work in the weekend, but there are times that the case is, it's a large case and patient wants to do it on a Saturday, and I'm okay with that. And then we make it, we make a special occasion and we work on Saturdays as well. But on a monthly basis, I think I work about either 18 to 20 days.
This question is for Dr. Pierre. How did your program director or chiefs or other colleagues perceive your decision to pursue a career in a corporate setting compared to a more traditional private practice or hospital-based work?
That's a great question. I'll say, I mean, it was mixed. I had mixed reviews. My program director didn't really see an issue with it. He was like, hey, go for it. Then I had some of the attendings that were pretty old school and like were thinking, stay in private practice or hospital-based or academia. But I'll say, I mean, overall, at least from my experience, most of them were pretty supportive about it. I think at this point in time, it's not, whatever the thought process when DSOs first came out and first started, it's not really the same thought process now. They see the place, they need for it, and most of my residents now are like, my junior residents are like calling and texting me now saying, hey, like, how's it going? Like, and they're asking me advice about joining and like trying to see when the next vibe sessions are now. So I've been, telling them my experience as well. But overall, the overall view was supportive. As long as you have a plan, what you want, you're not backpedaling, you're confident in your decision, at least on my end, they were supportive for the most part.
Good. Dr. Kim, what is it that has kept you with Aspen for as long as you have? And why would you advise doctors to pursue the same route?
I mean, like just say anything in life, it's not, not everyone may enjoy Aspen. I don't know. For me personally, when I was in the Army, I actually worked in the private side as part-time as well before I joined Aspen. And then, it wasn't really going where I wanted to be. And then I just, the whole seeing a patient was not consistent. So that's when I found Aspen. And Aspen, what gave me was a sort of a consistent, patient flow. And that was important to me because I was only working like back then. As a part-timer in Louisville, Kentucky area. I was working 5, 6, 7 days per month only. So I wanted to make sure that patient flow was there. And then I really enjoyed, working with the different office staff. I was covering about 8 different locations. And then kind of bring up to speed where I want them to be. It's almost like I was setting up my own, practices in each office. And since once I got used to that, basically once my team was, it was a oiled machine. So pretty much I was doing really well. And then, I wanted to continue as a full-time. And fortunately, like I said in the beginning, Aspen was able to relocate me for me to do a full-time Aspen. And my recommendation is, hey, if you want to, of course, right now in Aspen, I don't do any complex surgeries, obviously. I do mostly dental-alveolar stuff, pre-prosthetic, some limited pathology as well. But I am credentialed in a, obviously, bigger hospital here, near Johns Hopkins in the Howard County area. So if there are cases that the traumas and stuff like that, I kind of cover my own time. But obviously, if you are into more of cancer and bigger surgery, Aspen is not for you. But if you like running your own practices, if you're into dental alveolar implants and pre-prosthetic stuff, and I think it's just Aspen is a great environment for me to kind of develop my skills and almost feel like running my own business within a big corporate business. So.
Changing gears here a little bit. So the next question is, how many chairs are generally available for oral surgeons at each office? Who wants to take that?
So I run 2 chairs. Unless I get super busy, I try to run three chairs. 2 chairs is always given to me. In most of offices, they have 7 to 8 chairs in a typical Aspen office setting. And one, I primarily run sedation chair. And then second chair, I use them as more of a local procedures, consults, and post-ops.
Same for me. I have always get 2 chairs at each office. In certain offices, if it's a busy day, then they'll definitely offer me a 3rd chair, but primarily 2 chairs. And same like Dr. Kim, usually I'll have my main chair, like the sedation room that's already primed for sedations. That'll be the room that I do most of my sedations in. And then the other room could be like consults, local procedures, follow-ups, and stuff like that.
Awesome. Next question has to do with procedures. So someone just asked, does Aspen limit what procedures you can do, or is it only limited to dental alveolar, as you just mentioned?
That's a good question. It depends, obviously it's not an OR setting, right? It's, if it requires, what requires a sterile environment. To me, if it requires a sterile environment, I don't perform under Aspen roof. So I'm not going to do any cosmetic surgery unless you want to go into Botox and fillers, but I don't do them. If you want to do something bigger, if you're asking more about orthodontic surgery, and you can certainly take patients to a hospital setting, once you get a full credentials in a hospital set, and you will run into a patient that is has a lot of comorbidities. Maybe you want to take them to the OR instead of doing it under Aspen. Then, and I've done that. So, but for me, in Aspen setting, I only do limited to dental alveolar implants and limited pathology for now.
And so the next question is, do you see your own consults prior to doing the procedures, for example, sedation cases, or do the general dentist see them for you? Whoever wants to answer that can.
So I have obviously a lot of doctors always in contact with me, communicating with me. And now that I've been doing this, about 6-7 years, the office kind of understands how I run. So when patients are pretty healthy, ASA 1, 2, and stable, then I typically don't do consults. I try to bypass that. There's no reason. I try to do a lot of them. So Aspen gives us access to all the patient charts, and I could look at them at home. I could look at their panels and x-rays and their medical histories. So, and then even if they need med release for their medical history, my general dentist they understand that they're going to do that ahead of time. So before even I go there, I receive the confirmation saying, hey, med release are back. And if I approve, then patient will be scheduled. So I prefer not to do any unnecessary consults. Unless patient wants to see me and meet me first and make sure I look okay, I guess, then I let them. But otherwise, I like to see them on my day of surgery. I do talk to them briefly, 5-10 minutes, what the procedure is going to be. And then we go forward with that.
Yeah, I mean, that's a good question. And I understand the question, especially, coming from residency, we're definitely prone to like sedation. We'll always see it as a consult first, and then the patient is scheduled for sedation and stuff like that. So when I came out, I mean, for just like Dr. Kim said, if the patient was like, relatively healthy, no significant comorbidities, the generalists, they would just schedule it. And as I talked to them, the more significant cases or there's any medical issues, I was starting to see them as consult first. And then as I talked to them, they understood, okay, what I'm looking for in terms of a patient being a sedation candidate, their BMI, airway, stuff like that, medical history, stuff like that. Then it became easier for them to just schedule it. And like Dr. Kim said, they always text me, it's like, hey, what do you think of this? Do you want a medical consult for this? If they're on blood thinners, they're going to stop it how many days prior before. So, they've been able to manage that. And you can see the records, you can see the chart, you can see the medical history. You can look at the x-rays to see if it's a case that's appropriate for, that whatever you're going to do in the office or whatever the setting may be. And if you have any issues prior to that appointment day, you can always say, hey, actually, I want to see this first as a consult, or this is not appropriate, or blah, blah, blah. So you can make those recommendations prior to that surgery day. But again, you got to think of it also that since you're covering multiple offices, you may come to that office, twice a month, depending on how many offices you're covering. So you don't want to get there and it's just a day of consults. You won't be productive, and two, then it's just delaying treatment for these patients even longer. So if it's appropriate, you'll find that it makes more sense to, if it's an 18-year-old for wisdom teeth, there's no real reason to see that as a consult and then have that patient come back in a month to do the procedure. So.
Yeah, that's a good point. If I may just add one thing, it's very important from my experience. If you teach, we call them MCD, the person, doctors, general dentist who's in charge of their clinic, each office. If you teach them, what to look for, and then if you teach the office, what you're expecting for this patient to be set up properly, they'll do a lot of stuff for you. I mean, they'll get there, and especially, the complications will occur. That's just part of our life, right? So, and teaching them what to look for. These clinical directors, general dentists could be your eyes, and they'll do a good post-op follow-ups for you as well. And to me, that's a huge benefit, because I can't be in 16 locations every day, right? So sometimes you got to rely on them. And just like you guys have all the residents. We have experience having externs and interns. You teach them, and they'll. I'm not saying general dentists are interns and externs, but I'm saying you bring up to the speed where you want them to be, then it's the office is going to run as a oiled machine.
You get an opportunity to mentor general dentists in the process.
I think Dr. Pierre mentioned that earlier, so yeah.
This is a good question. Are there corporate pressures to produce a certain amount of hour, number of patients to see, a number dollar value?
No, the answer is no. I've never had any experience that, but then I've always worked hard. So, but I've never had anyone telling me, hey, how come you're not producing, or how come you're not working this many hours or something? A lot of the Aspen has, not only corporate office owns part of it, but there is individual owners to this office too. So, once you develop a good relationship, I mean, you won't have that issue. As Dr. Pierre mentioned earlier, the big advantage is having a, flexible schedule, and, you can pretty much take vacation anytime you want, if you need to. And then if you want to set your schedule as, hey, I only want to work Tuesday, Wednesday, and Thursday, and you can do that. It allows you to do that. So there's no real pressure from corporate. Hey, you got to produce this amount of money or production, or you got to work certain numbers of days. Now, if you don't work full time, if you want to work as full time, I'm sure there's a number of hours that you got to give per week, right, Veronica? So
15 days a month to be considered full-time. Changing gears a little bit with the new norm that we're living with COVID. What has Aspen done to help you and your patients feel safe in the office?
From the beginning, I think Aspen was very good with communication. We were basically supplied with good amount of PPEs, tremendous amount. Even Veronica sent me a lot of the, those expensive masks, and there's PPEs. There's there's no lack of PPEs at all. So Aspen was on top of everything. I appreciate how they were on top of everything to provide us what we needed. Obviously, vaccine is not mandated within Aspen. However, as a provider, I got my vaccine. So, that's something kind of they're asking you to do better on your own.
Mm-hmm. Thank you for sharing that, because I know that you were you continue to support our patients in the midst of when the crisis first came to scene, and so I was very, very pleased to be able to help you guys by even if it was just sending the N95s. This question, and Dr. Pierre, maybe you can start with it. What equipment does Aspen provide for you, and do you get to choose your equipment and supplies?
Yeah, you kind of do. So when you're starting up, obviously you're coming down with nothing. So they pretty much provide everything. They have an ordering template. Again, they are partnered with different vendors, Henry Schein, stuff like that, Nobel and stuff like that. So you get an ordering template that's kind of been compiled. So it was good. It was stuff that previous oral surgeons were already kind of using, ordering from. So that kind of helped me. And then you pretty much choose what you need. Like you think about, right, how many extraction trays do I want? Do I need to set up? So you order your elevators, your forceps, your periosteal, your Minnesotas, all that. So all that stuff is there that you can just kind of just put the number in of how many of each quantity you need. I got the Bien-Air hand pieces, straight hand pieces and contra angles for my implant. So those were great. So you can kind of identify how many, hand pieces you need. If you want the air impact as well as backups, you can get those, your implant order. So your whole startup, pretty much, they provide everything you need to start a practice. So I kind of felt like I'm like starting a practice here. Like, all right, what are the supplies from the gauze and stuff like that? So they pretty much provide all of that for you to start up so you can get rolling. Yeah. So it was great.
Yeah, the brand wise, I use a Bien-Air. It's a KLS Martin handpiece. That gives you both surgical handpiece and implant handpiece. So it's very convenient. You just set up one machine and you're ready to go for either cases. Monitor wise, we use DRE machine, the portable one that all my offices have a monitor stand ready. So we just bring in the monitor and just set them up and the room's ready to go. That's how we operate. And then I think there's you can certainly use Cavo as well as your handpiece. In the beginning, once you join Aspen, they'll give you a list of things that, you can pick and choose pretty much. And implant system wise, we use a purely Nobel only. I think you can use other brand. However, we have such a great pricing with Nobel, and I use Nobel Active pretty much everywhere, and I'm pretty happy with that.
So keeping in the topic of order, the next question that came up is regarding outpatient anesthesia. What drugs are available to you for sedations, and what kind of assistance do you have regarding patient wake up, etc.?
So I mean, pretty much the same drugs you were using in residency, you have access to here as well. So, Versed, fentanyl, ketamine, propofol, all your emergency drugs, Zofran, Toradol, glycol. So everything you need, everything you were using in residency, you have access to, and you can order for, your outpatient sedation cases here as well. And in terms of recovery, you can set up how you want. You can remember you have sometimes 2 or 3 chairs, so you can either, depending how you schedule your schedule, you can have your patient recover in the sedation chair. And when they're fully recovered, then you can have, train your assistant to, to be watching them. So however you want to set it up, or if you actually want to move into a second room to recover there, you can do it that way. Yeah.
And this, again, question could be for any of you too. Are you doing big implant cases like all on 4?
Yes, my answer is yes. I don't know if you guys know, obviously Aspen and Clear Choice just merged, so that was a big thing too. But all on 4 cases, I mean, as an oral surgeon, placing implants is pretty much the same, right? It's the prosthetic part. That portion requires some skill. Lab technician has to have some skill. So not every office is ready for all on 4. But if there is a general dentist whose skill level is like a prosthetist, then yes, you can do all on 4, and you can kind of set up that office as an all on 4 office as well. So I think to be able to do all on 4 is more dictated by what the general dentist could give you, in my opinion.
Yeah, Dr. Kim hit it on the money. It's really restoratively driven. So you definitely can do it. And it kind of really does depend on, how comfortable the restorative dentist at that office is with those type of cases. So you definitely are getting them. It may not be at every office depending on the general dentist, but you do have them. You do have those type of cases. Obviously the 4 implant in the maxilla, 2 to 4 on the mandible, overdentures are like, 9-day. Those are everywhere. So we're pretty much doing those at every office. But yeah, the bigger all on 4 cases, you definitely have to make sure you have a restorative dentist that, feels comfortable restoring those type of cases with a good lab tech for sure.
Awesome. And keeping in line with the implants, how often do you use CBCT for your implant training or implant planning? Apologize.
Yeah, I mean, fortunately, now it's more of a standard care, right? Getting a CBCT. So the Aspen is all the new offices now just automatically comes with CBCT. However, the old offices they don't have, some of them don't have CBCTs. So, sometimes, it depends clinically. If the ridge is good, I just go without CBCTs. But, I try to take patients CBCT just for to be a liability sake, just for my own viewing purpose, I guess. But
yeah, when I started down in Florida, so luckily all the offices I have, they all have a CBCT in each office. So I'm pretty routinely getting CBCTs. We have it at our disposal, so why not?
And for those offices that have been around much longer, the plan as an organization is to go into having a CBCT in all of the practices. It's just going to take a little bit longer, but we're estimating about 500 CBCTs to be installed here, just from when we rolled out the implant initiative. So great things are to come with technology. And if an office doesn't have it, but there's a sister office that does, we could always just have the patient,
right,
drive to the sister office and have the CT scan taken. So, this is a good question here that just came in. What are the advantages of full-time over part-time employment?
Yeah, I guess, I have experienced both. Full-time, just I guess I carry more offices. So definitely in terms of, compensation wise, I'm more productive being a full-time. And as a full-timer, you also, I guess another addition is that you get a company car, right? So the company gives me I think somebody asked a question about the Pathfinder. So they give you Nissan Pathfinder for me to travel each offices. So, and then, get a gas card as well, and that's a big benefit. But other than that, I'm not sure. Am I missing anything, Veronica?
So full-time benefits
Right.
package that you participate in. So your 401k, your life insurance, all that good stuff.
Sure. Yeah.
And we do provide malpractice stipend, a certain amount for full-timers versus part-time.
Our oral surgeons all carry OMSNIC, as you guys are aware. And then, the company gives us the 10,000 per year to cover that. In the beginning,
for
when
a
you come out of
full-timer.
residency, it should cover plenty, but obviously, when it's at a certain point, it goes beyond 10,000. So, but it's a significant coverage of that.
And when we're doing our one-on-one conversations this afternoon, we'll be able to go over specifically part-time benefits versus full-time. So stay tuned for that.
Mm-hmm.
Next question that we have here is, does Aspen offer continuing education opportunities?
Yeah, answer is yes. I mean, there's a tremendous amount of CE available. Especially one thing I really like about it is what Nobel offers. And then for the OS side, before COVID, actually, it was offer actually, in-person sessions. I was sent to like Riverside in California, where Nobel, where the factory is. And I was, there were a couple of zygoma, training and all this. So right now everything's virtual, but there are lots of CE courses available.
And we offer, like Dr. Kim just mentioned, in person, but there's obviously online opportunities. There's sometimes where a market might have something available there, and we'll make sure that we invite anybody that's willing to attend those sessions, especially if they're within driving distance. So maybe some of our participants joined a little bit later. So similar questions that were asked earlier, but who dictates treatment planning?
So a lot of general dentists when they see a new patient, they'll dictate the treatment planning. However, when it comes to a surgical side, you will tell them how you want your treatment to be. There's a set of, reference paper you can set up. Once you join the company, you set up, hey, I want wisdom teeth, set up wisdom teeth to be 30 to 45 minutes sedation time, and things like that. You can, set up so that as a guidance for them to look. And in terms of coding, right, like wisdom teeth, there's obviously surgical, partial boning, full boning, pack, and all this, things like that. I created my own sort of PowerPoint slides for them to kind of review. So I, basically set an example of, hey, this is full bony, this is partial bony. And then once you give them, and whenever there's a new doctor, I just send them an email. Hey, this is how I want my treatment, to be coded. And then they'll follow that guidance. So if you're, to answer to your question, basically you dictate your own surgical treatment.
Right, absolutely. And I mean, think of it, as specialists, whether you're here or in private or whatever, we're primarily referral based when it comes to that. So think of that. I mean, the general dentists are seeing these new patients, they're coming up with a treatment plan. The surgical aspect of the treatment plan that pertains to you, that's what they're referring to your schedule for. And then you can look at it, you can see the whole treatment plan, you can see what your part plays in the treatment plan. And, if you don't agree, then you say, hey, I don't think this is appropriate, or this doesn't need to be done. So you can always have that discussion. So at the end of the day, you do what you're comfortable doing. So no one's forcing you to do anything. No one's forcing you to see any patient that you don't feel comfortable seeing. So if you agree with the plan, like you would even if you were in your own private office, then you proceed with the treatment.
Well said. So on average, what is your traveling distance? Like your furthest offices, your closest office? Dr. Pierre, what's your average travel time? And then Dr. Kim, what's your average travel time?
So from mine, so I have one outlier in Gainesville that's about, for me, that's about like an hour and 50. which I'm covering that office right now temporarily. But my main offices that are around me are within 30 to 40.
Dr. Kim?
That's a good location. Mine probably, I mean, I'm more spread out. So like Dr. Pierre said, outlier, probably about 1:50 is my furthest one, because I live in Maryland, but I cover some of the southern border of Pennsylvania as well. And the furthest one is about 1:50, but that office, I go there once a month, and, you know, it's a very productive office, and it's a good office. And so, you know, I don't mind driving, but most of the others, probably 45 minutes, an hour, 1:15, you know, it varies.
So with all the travel that you guys have to do, how do you manage the post-operative complications and more serious infections that require incision and drainage?
Yeah, good question. I mean, that was my biggest concern as well, covering a lot of offices, you know. So the key is doing a surgery that, you know, try not to have a major complications. But, you know, like I said before, it's a number game. You know, you're going to have it, you know, sooner or later. If it happens, most of minor complications, you know, it comes down to how you teach that office staff. How do you teach that, you know, general dentist to what to look for? And that could be your eyes. And then if they tell you, if you feel like you need that, you know, IND needs to be done, you know, I think I've done it a couple times in my Aspen career, that I actually, you know, next day, I went back and took care of the patient. Or if I'm in the area close enough, patients will drive 20, 30 minutes, my next day location. I tell them to, hey, come on down to, you know, this location, and they'll be happy to just drive down, and I see them and I take care of them, you know. If it's something that needs to be done in an OR, then, you know, I've done that once in 7 years. And then I just take them to where I practice in the operating room, and I do the IND.
Yeah, I think Dr. Kim made a great point. I mean, first of all, you know, we want to be meticulous in the procedures that we're doing. So do good surgery, and that can limit the amount of complications. But with surgery, you do enough, you're always going to have a complication at some point. So we do our best to limit it, since we, you know, you understand that you're covering multiple offices, so you can't always be in that location all at once. But Aspen does have a paging system. A lot of times, I mean, it could be just a question that I'll get about post-operative stuff from the patient. They can always page me, and I'll call them back, or it's about a medication, or if they're having, you know, pain or something like that, then, you know, I'll definitely advise them, you know, go into the office, have them take a look at you, and then the dentist will always let me know. Most times it's nothing serious, you know. For the most part, it's probably like a post-op extraction. So usually never anything that serious. And if it is, obviously, you know, we'll take care of it. But most times the general dentist can look at it. And then if it's something that I still want to see, then they'll put it on my schedule if that patient can wait. And most times they can.
Yeah, I mean, we get paged all the time. Probably number one page I get is about medications, pain meds, right? And good thing about that is that Aspen gives us an access. I could actually send, even if it's a narcotic medication, you know, they need it sometimes. So I could do it over my phone. And that's a big benefit, you know, like sending a, you know, more than codeine, you have to actually physically, you know, we prescribe, right? So we do it electronically, everything electronically nowadays. So, and then being able to do it on my phone is huge, rather than calling the pharmacy and, you know, all that stuff. And plus you can't give it over the phone anyway, for more than like a Vicodin, hydrocodone. So, you know, being able to do it electronically on your phone is a huge plus. I can just do it at home. And then probably number two is a bleeding issue. So that's why it's important that your office understands the patients, you know, if patients are on the blood thinners, you know, that they'll be able to, do the med release before surgery, preoperatively, that everything is ready to go, make sure patient stops this and all this. So you don't get that bleeding post-op complications. So.
Here's the next question. Do you take call for any of the oral surgeons in your area as a way to build rapport and possibly get support from them as needed?
I think you can. I've seen a colleague who's doing that as well. So that, but for me, right now, no, I don't do that. I don't feel the need. I don't feel the need. But you can. I mean, actually, I have another surgeon covers other PA offices, like such as Dr. Whiting. I mean, if I really need to, I could call him up and ask him. So, within Aspen, amongst the oral surgeons, we have a good relationship. So you can ask for some support and you can support each other if you want to. I think that's just how you want to set it up.
Is it feasible to take trauma call as an oral surgeon at Aspen?
So, again, I'm like 6 or 7 months out, so I'll let you know because I'm actually in the process of setting that up. So the way according to my schedule, and I have some buddies that are oral surgeons in the area as well. Some that I went to residency with that are down here as well. So we've been trying to coordinate that because I did still want to do like, some trauma here and there. Most likely I'm going to try to dictate it towards the weekends because right now I'm on a Monday through Thursday schedule. So I'm in the process of getting credentialed at the hospital. I think they should have me credentialed by next week for the sake of doing one, if I need a hospital to go to, so at least I have those privileges, and two, to try and take some trauma call. So I may try to set it up where it's weekend call because I understand, during the week I'm in a different location, so it may not be feasible, I can get out 5 here and like the hospital is like now it's 2 hours away from where I'm, so it may not always be feasible, but I'm trying to set it up for at least like weekend call, maybe like a Friday to Sunday type of situation.
Yeah. Is that feasible? My answer would be yes. Yeah. I mean, if you like taking trauma's call, yeah. I mean, I personally like doing trauma calls, and it's, I mean, I'm not super active right now because I'm busy. Only question I had was, basically, I don't have my own practice, right? So if I need to do a follow-ups on these trauma patients, where am I going to bring them? Can I bring them into Aspen location and do it? Probably, if you talk to that office, but that would be my question. But covering trauma, yeah, shouldn't be a problem.
You have that flexibility, like the doctors just mentioned earlier. They're making their schedules. They're planning that with the regional managers of the area that they're supporting, and they're giving them 2 months out of schedules so that you guys can. I mean, you don't have to work 5 days a week to be full time. Dr. Kim is obviously, he's got a lot of offices, but you don't have to work 5 days a week in order to be full-time at Aspen. So you do have that flexibility that if you wanted to on the weekend, like Dr. Pierre is going to try to aim to do trauma calls, so that you're not feeling you're not using all your skills and all of your training. So we have about a few more minutes to ask a couple more questions. So the next one this one just came in. They just want more clarification on who travels with the equipment between offices. Is it the oral surgeon? Is it the dental assistant? Is it a combination of both? Who wants to take that?
So for me, I think when they told me when I started for Florida, it was different. So in terms of like the DRE and like sedation monitors, that each office has to have their own monitor. So we don't travel with a monitor or any sedation stuff. And each sedation office has their own sedation emergency card, and sedation drugs. Usually it's in like little lock key coded box, and then you just have to replenish and you can order it for that particular office and it gets sent there. But most of the instruments, I think Dr. Kim mentioned, my lead DA carries most of our surgical instruments. Usually I'll carry like some overflow backup stuff, like extra IV lines or nasal cannulas and stuff like that. I keep my own implant and bone graft little tackle box with me. But for most of the sterilizing instruments and stuff like that, my dental assistants usually carry.
Yeah, I'm in the same boat with Dr. Pierre. I mean, my lead DA carries all my stuff. However, I've seen other oral surgeons carry their own because they work with many different DAs. So I think it's more situational. Everybody's a little different. But for both of us, our lead DA carry our stuff.
So this, again, just asking for more clarification. Are you mostly working 10 to 12 hour days, including your travel time from your home, or is it more?
Depends on a day. Typically see patients from, 8 to 4, sometimes 8 to 5. So if I do that, yeah, including travel time, it's probably 10 plus hours, I guess. Mhm.
Yeah, I'm about the same. Usually 8 to 4, 8 to 5, and then by the time you clean up and get out, and if it's an hour commute or if it's almost 2 hours, then yeah, it could get close to that.
Yeah. So when you schedule, you want to be kind of smart about it, especially when you have many offices. I do. I try not to schedule, kind of long distance back to back, and you can't dictate that. It's like, hey, tomorrow, since I'm going to about an hour and a half drive today, I'm going to go somewhere I'm like about 30 minutes drive, so that you don't have that, the driving long distance pressure following day.
Yeah, and to piggyback off of that, Aspen is really great with that in terms of how you want to coordinate your schedule. Because, like I said, Gainesville's my farthest office, so it's about an hour and 50 almost commute time. So, knowing that I'm Monday through Thursdays and Fridays my day off, Gainesville is always on a Thursday, so I know like when I'm done that, I'm like done for the week. So they're great with coordinating your schedule like that.
Yeah, that coordination is you can dictate 100% for sure. Mm-hmm.
Absolutely. And if you're not sure because you don't know the market, the area, that's where you'll be able to rely on our field operations team to really support and making sure that, we want you to be treating our patients safely. We don't want you to be so burnt out that you're like, oh my God, I'm gonna have to stay overnight in the middle of nowhere. Like we'll make sure that it's safe and that we consider your travel time within your working hours. So.
Yeah. And if you need to stay in a hotel, Aspen will cover your hotel.
As well. Yeah. And that's a great point, Dr. Kim, because some of the benefits for both full-time and part-time specialists is there's mileage reimbursement. Obviously, with the full-timers, if you get the company car, then you don't need the mileage reimbursement. But even as a part-timer, we'll also reimburse you for your travel time. So here's and maybe this is more for Dr. Kim since you did work for us part-time, Doc. If you work part-time with Aspen, can you also work part-time in a private practice? How does Aspen handle that?
Yeah, I mean, when I joined Aspen, the beginning as a part-time, I was actually working part-time in the private side as well. So, but then because Aspen I was doing so well in Aspen, I stopped going to private side. But you can certainly do it. Aspen really doesn't limit you any kind. And if you want to have I've seen other oral surgeons who works with Aspen as part-time 2 days, and 3 days they do their own practice. So I think one of the questions, family owners are practicing the surrounding area, can you work in their office part-time? I think the answer would be yes. I don't think Aspen cares, right?
Yeah, as long as you're keeping Aspen's patients at Aspen, and you're making sure that when you work in a private practice, you don't sign a non-compete that's going to hinder you from supporting the offices you've committed to the owners at Aspen. We're not trying to make this difficult. We know that there's a lot of need. There's not enough access to care in these communities where we open up our practices. And so there might not be a full-time opportunity, and we're okay with that. We just ask that, again, you respect the owners, and if a patient can be done in our 4 walls, let's take care of those patients in our offices. There's no reason to refer them to your own private practice or someone else's private practice. Let's see what other questions do we have. So we already answered this question, but does Aspen cover your malpractice insurance? Again, we provide a $10,000 annual stipend to our full-timers, and then that $10,000 is prorated for part-time based on the number of days worked. Is there a minimum amount of days you need to work as a part-time surgeon? No, part-time for us is essentially considered anything less than the 15 days a month. Every office will need a minimum of 1 day a month to be supported. And as the market matures, they'll ask you for a second day, depending on the volume of the market. But it's typically Anything less than 15 is considered part-time. Okay. Does Aspen have preference for single degree or dual degree OMFS? I'm currently in dental school and I'm still not sure what are the benefits of medical licensure. What does Aspen look for the most in applicants applying? It's not a requirement to have dual licensing. It's really what your preference is. But Dr. Kim or Dr. Pierre, do you see any advantages to being a dual license?
I mean, there's definitely no requirement in terms of Aspen goes. I think that comes more personally to what you want to do. Again, in my opinion, between dual degree and single degree, in terms of traditional oral surgery, you're going to be able to do most with either one. You know, if you're looking to go into some type of fellowships like microvascular, you want to do head and neck, then probably dual degree will probably be better in terms of you getting in. Or I know some people want to go into like cosmetic fellowships. Although I've had friends that were single degree and went on to do that, and now they're running like, I would say primarily plastic surgery office, but it kind of depends on what you want to do. In terms of Aspen, definitely not required. I wouldn't say it's necessary either. I think as long as you get good, oral surgery training, whichever program you're at, you'll do great at Aspen. So it's more so a personal decision. If you want the dual degree to have it, sure. If you're looking to go into some type of fellowship like microvascular or something like that, then it'll probably be beneficial for you, in my view.
Yeah. I mean, it certainly is an honor to have dual degree. And I think we have about 70 active oral surgeons, Veronica, if I'm
Not more like 85.
more like 5. Okay. Oh, so, we have a good mixture of single and dual degree, but just to briefly answer that question, I think it helps to, just like Dr. Pierre said, to do some fellowship and get credentials and privileges in hospital. And plus, you're going to work with other MDs, and it's nice to have that degree to, kind of work as a team and work together. And I think they give you respect for that dual degree.
Absolutely. The next question is, how does it work with liability insurance if you work at Aspen in a private office? Do you need 2 separate coverages?
No, you do not. Once you have an arms and knee coverage, it's an umbrella coverage. So, you don't have to have a separate coverage. For example, I cover, medical center as a sort of a, trauma calls and whatnot. And then I use the same arms and knee coverage there.
And as Dr. Kim mentioned earlier, most oral surgeons use arms. There are a few that are not certified with members of AMIS, but really all you're going to do is just make sure that the Aspen dental offices are listed under your COI and provide that to us. And it's pretty simple. We don't make it too difficult. Try not to anyways.
Yeah, that's a good point. Yeah, adding more locations does not change your sort of a fee when it comes to insurance coverage, liability coverage.
All right, and let's see if there's any other questions. Oh, the last one. Is vacation time limited?
We don't have a vacation pay as an oral surgeon, right? But then there's no limit days, I don't believe.
Correct.
Yeah.
All right. So before we end, I want to say thank you to Dr. Kim, Dr. Pierre for taking this time to share with us. Thank you to all the participants for all the great questions. And finally, I want to just make a friendly reminder that if you're scheduled for one of our one-on-one career guidance conversations with Dr. Pierre or Dr. Kim, or interview with one of the field operations team members, please do not enter the assigned Zoom room any earlier than 5 minutes from your scheduled time. And please enjoy the rest of our Vibe event and have a great weekend. Thank you, everyone.
Good luck, everyone.